Hi, everyone. Welcome and thank you for attending today's webinar, Teaching and Learning Public Health in the COVID-19 Moment, presented by Springer Publishing Company and featuring Dr. James Shultz, Dr. Lisa Sullivan, and Dr. Sandro Galea, the authors of the textbook, Public Health: An Introduction to the Science and Practice of Population Health. My name is David Diodana, and I am the senior editor responsible for the Public Health and Health Administration publishing programs here at Springer Publishing. For those who do not know much about Springer Publishing Company, we are an independent publisher known for innovative textbooks, professional references, and clinical products in the fields of nursing, behavioral and health sciences, and medicine. Before I introduce the presenters, please note that this webinar will be recorded, disseminated, and posted on our website in case you missed any part of the presentation. And we will also be taking a few questions at the end of the presentation from the audience through the chat feature on Zoom. Please feel free to send along any questions as we go during the presentation itself. Next. Dr. Shultz is a population health scientist and the director of the Center for Disaster and Extreme Event Preparedness at the University of Miami Miller School of Medicine. He teaches public health courses and advises MD, MPH students in the Department of Public Health Sciences. Dr. Sullivan is Associate Dean for Education, Professor and former Chair of Biostatistics at Boston University School of Public Health. She's engaged in a wide range of research endeavors, including the Framingham Heart Study, and she is an award-winning educator. Dr. Galea, a physician, epidemiologist, and author, is Dean and Robert A. Knox Professor at Boston University School of Public Health. He is chair of the Board of Association of Schools and Programs of Public Health and past president of the Society for Epidemiologic Research and of the Interdisciplinary Association for Population Health Sciences. Next. Here's today's agenda, and with that, I'll hand it over to Dr. Galea. Sandro?
Thank you, David. Thank you, everybody, for joining us, and thank you to my co-authors, Dr. Sullivan and Dr. Schultz, from whom you're going to hear in a second. We're going to do 4 things today. I'm going to lead you to numbers 1 and 2. I'm going to talk about why COVID-19 creates a unique opportunity to teach public health, and I'm going to discuss how COVID-19 really fits in very well with the frameworks the book takes. The book takes 2 frameworks. It's a life course framework, ecosocial framework. This work is built on the work of many scholars that have come before us, including people like Professor Koo for life course, Professor Krieger for ecosocial. But we've adopted these frameworks as just an organizing perspective that we think is helpful to think about population health and can guide public health. And they really are the backbone of the book. We'll talk about how we can teach public health more effectively in the moment. And then Professor Schultz will end by talking about specific examples of COVID-19 learnings applicable to broader public health agenda. So that's really the broad agenda we're going to go through in the next 20 minutes or so. Next slide. So before we start, we just want to do a quick poll. Are you currently using specific aspects of COVID-19 pandemic as a way to engage students in your course? Everybody should have a poll question that popped up on their webinar. If you can actually submit that, and we'll see the results on the screen in a second. Right, it's what we thought, which is the vast majority of us are using COVID in some way or another, which of course makes all the sense in the world. So let's move on. Next slide. So first of all, I just want to frame why COVID-19 creates a unique opportunity to teach public health. I think we all have an instinctive sense of it. I mean, how could it not, right? In some respects, we've been living through it now for a year. And but I think it's helpful to think about structurally how explicitly COVID intersects with the agenda of public health. Next slide. So public health has been dominated by COVID. It has really been what has dominated the public conversation and really has dominated the presence of public health and how it intersects with the world. I do think it's fair to say that insofar as public health was an obscure discipline before, it's no longer the case. Areas like epidemiology, biostatistics, and modeling have become lingua franca on everybody's lips. And we are seeing nationally tremendous increases in applications to undergraduate public health, to graduate public health, largely driven by interest in COVID. So connecting learners to COVID is, to our mind, almost inevitable. And I think it makes sense to weave it into all our teaching. And the way we think about it, the way we think about what we've done in the book, we think it lends itself quite well to that teaching. Next slide. Public health, I mean, how does one teach public health? We can obviously spend the whole webinar on that. And in fact, we at the School of Public Health here have organized several symposia around teaching public health and around best practice for teaching public health. But fundamentally, we think that public health is a practical endeavor, that we best teach public health by being engaging, by being authentic to real world activities and examples, and being inclusive of a variety of perspectives and inclusive of a variety of people who actually make the science of population health and who make the practice of public health. So the COVID moment, with its direct applicability to our daily life, is very much something that's practical, grounded in authentic real world experience, and involves all of us, making it something that's core to an inclusive, pluralistic approach to public health. Next slide. Just to give one example, one of the core concerns around COVID has been the disproportionate impact that COVID has had on cases, hospitalization, and death of minority Americans, of Black, Indigenous, people of color. What you see here is among American Indian Alaska Natives, you have 2.4 times the death rate. Black or African Americans, you have 1.9 times the death rate. Among Latino, Latinx populations, you have twice the death rate compared to white populations. So this, of course, gets at the very heart of much that we care about in public health. It gets at the heart of prevention. It gets at the heart of equity. It gets at the heart of population health. The why is it that there was an increase in cases, hospitalizations, and deaths among Black Americans compared to white Americans? Largely because of factors linked to social exposure, economic exposure, greater risk of contracting COVID, but also greater underlying morbidity and morbidity, which goes back decades, which reflects the underlying social structures that predetermine health, that then predispose particular groups to greater risk of death once they contract COVID. So just this one slide intersects with multiple aspects in public health, which of course really makes the case why COVID matters so much in terms of teaching of public health. Next slide. So how do we understand COVID through these perspectives, through this life course perspective, ecosocial perspectives, which, as I said, really build on the work of many scholars over time. And but we've taken a very simple approach to this in the book. The book certainly does not lean into extensive theory or anything like that. What the book simply says is a life course perspective tells us that we can understand public health by understanding how health is generated in early life, in infancy, in childhood, adolescence, later adulthood. And we can understand public health by understanding how the individual is nested within her social networks, her neighborhood, her country, the policies that influence all of us. So really taking a longitudinal perspective and a nested multi-level perspective to understand the determinants of health. That is true. We think it held when we wrote the book a couple of years ago, and it holds even more true now as one thinks of adapting COVID examples to this learning. Next slide. Just to give an illustration about life course perspective, we can think about the risk of COVID infection by death and by age group. And so if you look at cases, just look at the row of cases, you have, if the reference group is essentially children and adolescents, children under 5 have less than 1, but you get to 18 3 times, over 30 2 times, 2 times, 2 times, and get to over 85. You have sort of also twice as many cases, but look at deaths, for example. Deaths increase 15, 45-fold, 130-fold, all the way to 7,900-fold when you get to over 85. This really shows how COVID has intersected with different stages in the life course in different ways. And there are reasons for that, which as a student being taught about the science of population health with an eye to public health practice, I would want to know, and we want to understand why is that, and what is it that creates particular vulnerability in different groups at different ages, just like there's vulnerability in different sociodemographic groups and different racial ethnic groups. Next slide. And then thinking about a social ecological framework, thinking about how we are ultimately nested as individuals within our family and social network, a neighborhood where we live, the country where we live, And all of this has direct applicability to COVID. The individual chooses to wear a mask, chooses to hand wash, chooses to physically distance. But we are living in intergenerational households, for example, or we may be associated in our community with events that are super spreader events. Our neighborhoods may adopt curfew, restaurant restrictions or not. They may actually have mask mandates or not. There may be schools that are open or not, which result in children mixing or not, and results in curtailing of social and economic opportunity for children that's going to have tremendous implications for them throughout the rest of their life course. And of course, the national response, which ultimately dictates testing and vaccination, which ultimately comes down as a national level policies that influence our neighborhoods, influence our family, influence us as individuals. So these two perspectives, the life course perspective and the social ecological perspective, together combine to create the framework within which we can understand to our mind all of population health science and guide all of public health practice. And all of that has been eminently manifest in the time of COVID, and all of it can actually become really useful teaching tools as we think about teaching in a way that's pragmatic, that's authentic, and that's inclusive in a time of COVID. Next slide. So now I'm going to turn it over to Professor Sullivan, who now is going to talk about really, okay, having said that framework, how do we now go on to teach public health more effectively and elevate universal concepts through the COVID moment? Lisa.
Thank you. So I'm going to talk more generally about how we teach public health using COVID and think about some strategies for optimal teaching and learning. And the first is to consider our learners' characteristics, backgrounds, and lived experiences. We are all living in COVID-19 right now, but it's not impacting us all equally. And so what we need to understand to make the most of this moment as we're teaching public health is to help students to make connections, to activate the experience that they are living, and to connect those to the things that we're trying to teach them in our public health courses. Because connecting students to what they know and trying to get them to engage with new material will actually increase their motivation to learn. And really, we want to engage students in this real experiment that we're all living through in finding solutions to these complex problems. So what I'd like to talk about are four sort of general strategies that we take in the book that we think are effective ways to optimize teaching and learning using the COVID example. So first is making connections. So population health science tells us what we need to know to understand what causes health, so that in public health, we can intervene to make populations healthier. In the book, we talk about the many achievements that public health has had, and two in particular, vaccinations and control of infectious diseases, are immediately applicable in the age of COVID-19. And one of the things that I often find very difficult to teach as a biostatistician is making decisions in the face of uncertainty. And we're surrounded by this right now, and it's a perfect example for students to see how we as public health professionals have to sometimes make decisions when we don't have complete information. And it's just a way to try to make the learning real for students by engaging in what's happening literally around us at the moment. The second, as Sandro said, any course or book in public health has to focus on health equity. And you might think that a global pandemic would adversely impact every member of the global population, and it does in some ways. But unfortunately, it affects different members of our population in very different ways. And our students are so passionate about social justice and health inequity. This is a perfect example for them to engage and direct their passion towards understanding these inequities, these structures, these systems that have created the problems that we're seeing today play out with COVID. The third is getting students to think about health trajectory. So we talk in the book about the life course, and just to focus on children for the moment, children rely on an early life environment that provides 5 domains of nurturing care: health, nutrition, security and safety, responsive caregiving, and early learning. COVID-19 has exacerbated threats to health, and particularly so for children who live in poverty and in under-resourced school districts. the impact of what they're experiencing now will persist throughout their lifetimes. And understanding what different age groups are experiencing now and what that might mean for them in the next phases of life is critically important for students to understand public health and to actually make a difference. And then the fourth approach is, as Sandro mentioned, inclusive teaching and learning. So this is ensuring that all students have the ability to achieve their potential. And we need to be sure that they all have equal access, equitable access to content, to course material, and to learning activities. And we also have to value differences, not just understand that our students come with different experiences, but we have to really value those differences because they're really important in our discussions of complex issues like COVID-19 in the context of health. So in the book, we offer variety in course content and strategies for assessment, different ways that you might engage your learners, and we really try to focus on high impact practices. So our approach to teaching public health, and again, as the way we've constructed the book, is to get students thinking about public health through causes of health. We offer discussion and reflective questions, and Jim's going to go through some specific examples in a minute. We have test banks that instructors can use, and we try to bring in a wide range of examples. As our public health students have so many different interests and passions, we want to make sure we can connect all of them to this material. We also try to really promote active learning, and we offer active learning exercises for each chapter with videos and other kinds of ways to engage students in content so that they can contribute to a class discussion. And we'll talk a bit more about podcasts. This is something we think is unique and a real differentiator for this book because it's a nice way to engage students in the material. And then again, thinking about high impact practices, these are ways to get students actively involved in the course, and it motivates them and promotes deeper learning. So just as an example, to get a conversation started, you could ask students, do you live in a large house or crowded apartment? Are you or your housemates working, taking public transportation? Does anyone in your family or your inner circle have a chronic health condition? Or do you live with someone at higher risk? And how are your experiences then shaped by the life course and eco-social perspective? So this is just an example of sort of a big picture. And I'll turn it over now to Jim, who's going to take us through some specific examples using COVID applicable to a broader public health agenda.
So thank you so much. And as Lisa was saying, we really do have multiple tools attached to this textbook, but we are going to emphasize right now case studies, and we like case studies. We have 37 of them in the textbook and one or more in every chapter. We selected 15 chapters to go along with a 15-week semester, and every chapter has a podcast attached to at least one of those case studies. So now we're going to be talking about some of the things we've developed specific to COVID, but before that, I think we have a poll question. Next, please. So that looks like many of you are not using podcasts at this point. It looks like yes for about 21%, and no but or no I do not for most of you. So let's move forward on this. And could I have the next slide, please? I wanted to mention that today is March 11th, 2021. And this is really an auspicious date because exactly 1 year ago was the date in 2020 when the World Health Organization declared COVID-19 to be a pandemic. And so this has been a 1 year period. It seems like we've lived multiple lifetimes in that time. And what we have with a sequence of case studies that we've developed is actually a series of snapshots of things that have happened in this 1 year period. And so what you will see is we have 15 chapters. We have 15 COVID-specific case studies, in addition to the 15 that were originally produced for the textbook. Next slide. The organization of the textbook, as Sandro had mentioned, is really in 4 parts. We start with the introduction, talking about public health, population health science. We talk about those perspectives in terms of multiple levels and life course perspectives. We talk about what's at the heart of public health, prevention and health equity. 3 chapters, and we have 3 COVID-specific case studies and podcasts. Then the next section is where we expand on that eco-epidemiological or multi-level approach. And here we have 4 levels going from individual up to societal, policies, and politics. And we have 1 of our COVID case studies for each of those 4 chapters. We then have 4 chapters dedicated to the life course, going from the youngest young to the oldest old in 4 steps, and 4 COVID-specific case examples as well. Our last 4 chapters are dedicated to various aspects of methods: epidemiology, public health practice, system science, and community engagement. And we again have 4 COVID-specific case examples, case studies with podcasts. Next, please. But it's important to understand with COVID, we have a different situation. We're really drinking from the fire hose at all times. A case study that we wrote last week would be actually a historical event this week. Things are happening so fast. The quantum of information that's pouring out is so vast that it's really hard to keep up. So I think the best way to think about our case studies, next slide, is actually more like a series of snapshots from the pandemic. Now, that doesn't mean we stop with the 15 we've given you, because even those are time dated to when we wrote them. But in fact, right now, I happen to be teaching not only intro with our textbook, but also a COVID elective class. And so our COVID elective class is one place that we're using the new COVID podcasts. And it's also a place where we are having our students develop a whole series of new current case studies. That might be something to discuss during the Q&A as far as whether or not instructors who adopt this textbook might want their students to start to contribute case studies as well. Next slide. Now, just to give you bigger print so you can actually read this, when we talk about the introduction section, we have 3 chapters. And for example, the COVID case studies for chapter 1 deal with the fact that when we were first dealing with COVID, this was spring break in Miami. This very week, last year, we never came back. We were closed for 2 weeks and started virtual online sessions thereafter. So everybody had that sense of susceptibility. All of us were immunologically naive. Anyone could get COVID. That's chapter 1. And then we also talked, as was mentioned earlier by Sandro, about the multi-generational nature of COVID transmission in households and in the community. And also mentioned by Sandro, we have for the chapter on both prevention and health equity, a COVID case example, which focuses on the disproportionate impact in terms of cases, hospitalizations, and deaths in Black Americans. Next slide. So there are many sources of cutting edge case studies. These are always being produced. And since many of you, 86% of you, I think, are teaching COVID in some format in your classes, it's good to know that CDC, particularly now, is really up to speed. So this just came out last week from their COVID-19 science update. Next. And we also have science briefs. So there is this particular article that came out a couple of weeks ago on variants, which are really front and center in our concerns about where the pandemic is going. Next slide. And where it's going, in part, it already is. So I'm broadcasting from Miami, Florida, and you can see that we are #1 in the state of Florida in terms of where we have known cases of the B117 or UK variant. Next slide. So we also, and some of you know this guy, but I come from Minnesota originally, and I was at the state health department during graduate school when Michael Osterholm was the state epidemiologist. He is now the director of the Center for Infectious Disease Research and Policy at University of Minnesota. He has his weekly Osterholm update. And so in my COVID class, my students listened to this 1-hour podcast, just came out with the installment this morning, and we'll have a team of students presenting this in class tomorrow. We do a lot with teams in our classes, introduction, as well as our COVID specific class. So in the introductory class, for example, every week we have a team that presents about a specific disease, and they actually use this framework. They look at the eco-social and life course perspectives prevention and health equity for that disease. We have another team talking about a prominent risk factor. We have a team presenting on current events. And so teams are really useful, including using them for presenting the COVID case study of the week. So in our intro class, we actually use one of the original case studies. We play it, and then we have a team present it. So that's how we use teams in both of our classes, intro and COVID. Next slide. So when we get to the next section, which is actually the eco-epidemiologic levels, the multi-level approach, we have 4 COVID-specific case studies. One is about super spreaders. So when you think about super spreaders, you probably think about the influencers, the people who literally spread the viral trends and sometimes the viruses themselves. But in this particular study that was from emerging infectious diseases, you have this almost inconspicuous index case. It's an interesting case study. Take a look. This is actually goes against some of the stereotypes of what a super spreader might look like. We also had COVID-19 clusters, and when that particular case study was written, the big clusters were nursing homes, churches, prisons, meatpacking plants. Of course, there are other centers that have become clusters thereafter. And writing from Miami-Dade, we were at that time when this case study was written, just brimming with COVID cases. Our hospital here had 485 COVID beds. Our UMH tower had another 150. And so this was really prime time inside of a state that was just flaring with cases at the peak of the summer flashpoint. And then we also talked about what happened. Unfortunately, at the time that we were writing this, the reputation of the CDC had really been harmed during last year. Trustworthiness for CDC had plummeted from 70% down to 17%. We think that with Rochelle Walensky and others on board now, that much of the trust in this national treasure is coming back. But that was our case study last summer when we wrote that particular chapter. Next, please. So we also know other sources of podcasts. So many of you know Dr. Howard Bachner, who is the editor-in-chief for JAMA and JAMA Network, who is just getting bombarded with this huge throughput of manuscripts coming through the JAMA system. But he also has time to give his own podcasts. Next slide, where he is actually the featured person interviewed. And then on the right side, sometimes he is the interviewer for people you probably know like Tony Fauci. Next slide. So again, podcasts are used a lot. Many of you are not using them, but there are great sources of podcasts, and we've also tried to contribute to that with 15 COVID-specific podcasts. 4 of them are about the life course. So big time topic right now is we're starting to try to open schools, getting schools open in the first 100 days of the current administration. So what do we do about the do-over for that lost year? We have a lot of students who've really fallen behind, for whom the virtual learning environment has not been very ideal. And also we talk about our own students in our classes in undergraduate and graduate public health who really had life experiences put on pause, who suddenly went indoors, suddenly like ourselves today, became thumbnails. And this is a different transition for our students. But we also talk about something that Sandro and also Catherine Edman have written about really compellingly, and that's that in emerging adults, 18 to 29-year-olds, these individuals have had just an extraordinary increase in mental health symptoms, depression, anxiety, trauma, and stress-related disorder, increased suicidality. And this was actually presented in JAMA last year, where they found a tripling of depression symptoms in the first months of the pandemic, but even more so in the emerging adults. For older adults, of course, that's a story we all know, where there's this concentration of comorbidities and risks for severe illness and death. Next, please. So other sources of podcasts, just FYI. Next slide. And coming to the final 4 chapters in the method section, I'd like to highlight 2 of these because chapter 12 actually looks at very new adaptations of epidemiology. Next slide. And for example, this was a study done by San Diego State University where they looked at the Sturgis bike rally in South Dakota. Almost 500,000 people came together. You can see the red for the county where they were all clustered. And by looking at cell phone signals, they found out where they'd come from, where they went back to. And in their analyses, they actually predicted that up to 1 out of 4 of our new COVID cases in the month of August during that incredible flare we had last summer may have been connected through bingity-bangity-boom connections back to Sturgis. Next slide. And finally, something that we do a lot of, and I've written many times with Sandro on climate-driven hurricanes. Climate is making storms stronger, wetter, and slower moving. In addition, now we have the complexity of COVID. 2020 was the year with the most storms ever, 30. 12 of them made landfall in the US. And the key point here was, guess what? We actually had COVID. So our time-tested strategies of evacuation and sheltering people together flew in the face of how we had to separate and keep people apart for safety during COVID. So that's the end of my presentation of the current set of 15 case studies on COVID. We hope maybe we'll be able to generate even more. It's happening in my classes right now. So that's the end of my comments at the moment. Here are some of our references going back to our epidemiologic and life course and other backgrounders for what we put into our textbook. And now we're ready for some questions, and we might even have some answers.
Thank you, Jim. And thanks to Sandro and Lisa as well for the presentation. We will now be taking questions. So if you haven't sent one and have a question for the presenters or for Springer, please send any through the Zoom chat feature or Q&A feature. One question that we received during the presentation, when it comes to incorporating COVID-19 content, how would you direct instructors who are teaching in an asynchronous online program? Anyone want to take that one?
Maybe Lisa, you want to take that?
Yeah, I mean, the podcasts are an ideal way for students to get some background, self-paced, you know, in the asynchronous format. And I think the discussion questions that we offer can be used in an asynchronous format. I think we all think of our in-person classes as the only way that we can have discussions, but I think that there are many really good ways to engage students in the asynchronous format as well. So for some of us, it is a different way to teach, but I do think some of these course materials, active learning, discussions, all work extremely well in the asynchronous format as well.
Just to add to that, we have at our School of Public Health, where Lisa and I are, we now, a year plus into the COVID moment, have developed quite a bit of experience with trying to figure out how to teach remotely, how to do synchronous, asynchronous learning. And as I mentioned in my introduction, we have done a number of symposia around best practices on this. You can find them all on the Boston University School of Public Health's website. They're all free and publicly available. And Lisa and I also did a book called Teaching Public Health, which was really, it's not a textbook, it's intended more of a series of essays about best practices and things like that. So if anybody's interested in more sort of best practices procedurally about how to teach, you may want to look at that as a helpful resource. And we certainly devised this book with Jim's leadership, sort of reflecting what we had learned from those best practices over time.
Thanks, Sandro. This was another question here, but I think it's more for me. How can I access these COVID case studies and podcasts? Well, that's a good question. We have a supplementary document and material ancillary for instructors that will be available on our online platform, which you can access through the print book with the code inserted on the card. And if you're on ebook, then you'll also be prompted for any ancillaries. If you're an instructor, go to your salesperson as well that's in your region, and we can provide that information to you. If you answer the survey questions at the end or get in touch with us, we can get you the right person to help you access those if you cannot find them through the book itself. So instructor copy, there's actually a slide after this that will be a version where you could go through the link or type in the link to get to the book page, and therefore request through our website. But you can also send us your information and contact us, and that we can get you in the right person to send you an instructor copy or unleash the access to the online platform if you want to just review the e-content.
Maybe Lisa, we just move to the next slide just so we have it up. So in the next question, maybe Jim, you could take the next question. I think it's a good question. It's, if you're using podcasts as the science behind the speaker, how do you determine which podcast to use and one's will or will not spread misinformation? I think, Jim, you've done a lot of thinking about this.
Yeah, so I think it's really, really important. One of the things we're doing in our COVID class is we actually have gone to the national strategy that was released the 21st of January. And the very first goal out of 7 goals in the national strategy is to actually restore trust. So this is a major issue because there has been so much misinformation. And so there's a lot of verbiage about truth, science, data-based, evidence-based in our national strategy. So that's good. So who are some of the lead agencies that actually produce this? And they certainly would be CDC. So I just showed you some of the materials on the CDC website. And then certainly we've got some very revered medical journals, New England Journal. I showed you JAMA, for example. So everything that we put together, of course, we put together our references. So we try to be very data-based in all of our podcasts, which are based on our case studies, which are then documented. So you can see where we got the information and what we're referencing. But I think medical journals of renown and various government sources, including WHO globally, including CDC and NIH, are very, very solid sources. And we're really trying to get back to a trust in those sources now.
So there's a couple.
Go ahead, Lisa. No, can I just add on the podcast? I have to say, Jim has done a phenomenal job on these podcasts, and they're really just engaging stories more than an enumeration of the science of the moment. They're really designed to get students interested, and we purposely had them recorded by students because we wanted other students to feel that they were accessible. And I have to say, I sat with some of the students who were doing the recordings, and they would read them and they would say, I didn't know that. That's so interesting. And they're really put together in a way that they're designed to be good, engaging stories, so that then when you get the students in front of you or online, however you teach them, you can use them as a jumping off point to go deeper into the material.
Yeah, so we really did have the students engaged. So they actually helped us a lot with the slide sequence. I actually was in charge of doing the slides. We have 1,000 slides for the 15 chapters. So it's, there's probably not another more detailed set of slides. And so students actually helped in organizing the slide sequence. But then in addition to that, they also helped in organizing the test bank questions. We have, I think, over 800 test bank questions. So the students were very involved, but the actual recordings for the podcast took place at BU. And so I've not watched the recordings take place. I've watched the students in my classes listening to the recordings, and they really appreciate having the student voice. And there are students, fairly inclusive and international cast of students who narrated the podcasts. So I've seen the podcasts on the receiving side, and the students really like them.
There's a couple of questions which are roughly the same thing, which is about will we have questions reflecting podcast content or particularly around COVID? And the answer is, as Jim said, we have a lot of questions, and the podcasts are pretty general, but as Jim said, stories about the book. And some of our questions do touch on things that are relevant to COVID. But with the second edition of the book, I think we will be revising all the questions, and I would expect us to have a lot more that's more directly relevant to the COVID in the next and the past year. Jim, maybe you can take this question about misinformation. We don't explicitly address it in the book, but maybe you can actually offer some thoughts about how an instructor can address misinformation around health with this teaching.
So I think that was what I was attempting to address. Apparently I didn't catch the misinformation piece, but when I was talking about what about the source of podcasts, I think is what the question is asking. How do we know this is a good podcast, a good source, and it's not a podcast that's going to spread misinformation? So I think that what I was mentioning is that was why we have really been looking to getting a lot of our information. For example, I mentioned that super spreader event that actually came from an MMWR article from the CDC. So we really tried to get information that has been vetted, that has been scientifically sound. And so we're not looking at, in our own podcasts, All of those are based on science. And then other sources of podcasts are some of our agencies that are most renowned for giving, really solid guidance in some of the major medical journals. So that I didn't highlight enough that was also to make sure we don't spread misinformation, both in the way we construct our podcast, our case studies. The podcasts are just a script based on the case study, so they're very tied together. And also just recommending in the presentation today, other sources, since many of you haven't used podcasts yet, there are some really outstanding podcasts. That doesn't mean there's not a debate. Mm-hmm. Let me give you an example. Michael Osterholm is very upfront about this. He has been one of the people who's been saying, and he also has actually put together a position piece that it might be good for us to try to vaccinate as many of our seniors, our 65 and over population, with 1 dose first before we get 2 doses for everyone. That's been actually a major discussion point. He's been on Meet the Press about that and so forth. Turns out the folks in decision-making are probably going to continue with the 2-dose regimen for Pfizer and Moderna, okay? So it's not like it's misinformation, but there will be points of discussion. And because of the nature of COVID, there will be things we just don't know. And so what Mike talks about in his podcast is, I just kind of call balls and strikes. And what I can see now might be different from what I can see 3 months from now. So it's not like we've got perfect science, nor do we have perfect information, but we try in everything we're doing with the textbook and in anything we recommend for our students to look at, that they go to sources that are well known for having a history of having dependable, trustworthy, evidence-based science.
Lisa, maybe you can address the careers and industries about, we have a lot of experience with this in our program, and how the book gets people prepared for that.
Yeah, we have a chapter on, well, several chapters that link to all of the different sectors and industries and all of the different professionals that are engaged and important in producing health. And so while we don't call out specific careers, I think we do make it evident that public health professionals are needed in every industry and every sector to actually make a difference. And people in every industry and sector are well served with an understanding of public health. So it is an interesting suggestion. I've seen some recent textbooks actually now include chapters for students on all the different possibilities that are available to them. And it may be something that we want to engage in the future. It's actually hard to stay on top of this because thankfully our graduates now with training in public health are literally going into every sector and industry. So it might be challenging to lay that out, but it is an interesting suggestion.
Yeah, and just to add to that, if I may, when we were thinking about this book, Jim, Lisa, and I, we spent a lot of time thinking about, how do you create a book, an introduction to public health book, mostly geared pretty clearly at students who don't know anything about public health, that is general enough to be the foundation for a broad array of career trajectories. And when we designed the book, the reason the book was designed with this framework, with 2 different frameworks, extending over the life course, longitudinally explaining to people how health is generated over the life course, and explaining to people how health is generated because of how we are nested within the ecological frameworks around us, within us, our families, our neighborhoods, our country. It is, I'm hoping everybody can see a very broad lens, because what we said to ourselves was, we want this to be the foundation for people can then take advanced public health after this that builds on this, or this can be the only public health course they ever take. And they can go into private sector, they can go into public sector. And our general feeling is knowing this will be better for everybody. In some respects, I see public health as the way one might see, for example, psychology training. There's a lot of people who train in psychology. Most of them never work in psychology, but that's okay. The world is probably better to have more people understand psychology. And I think the world will be better to have more people understand public health. And it's this framework that we try to instill in the book.
One of the things that I do in my teaching that I did pre-textbook and I continue to do now, although it's remote, it's virtual, is I always make it a point to have a one-on-one with every single student in every single class, every semester. And the gist of the conversation, although they can take it in other directions, is literally at this stage, how does public health work for you? What do you see yourself doing in public health? How does the framework of public health that we're describing fit for your own personal aspirations and career goals. And we may catch people at different times, at different stages, but the idea is really to find out, how does public health work for you? And I think this textbook really fits with that as well.
Thanks, Jim. Yeah, I would just add that, if you want more information on public health careers, Springer is actually publishing the 3rd edition of 101 Plus Careers in Public Health, which actually could pair really well with this text. You could also get in touch with the sales person in your region about access to that book when it's available as well. And it would be a nice discussion point, I'm sure, with these the 2 perspectives in this textbook. I think the last question asks about test bank again. As Jim stated, I think we have nearly 800 multiple choice questions throughout the book that you can use in your classroom. If there is a huge need for COVID questions, it's something we might do in the future, as Sandro suggested as well. But please give us feedback if that is really important to you. We'll have a debate about the best way of going about that. This is not a new edition. I just want to clarify, this is not a 2nd edition yet, but it is kind of a revised kind of edition in the sense that COVID impacted us, so much in the field of public health that, we felt it imperative to add this content, to this book, although it was already published.
I'll just make a comment about is the book for graduate students, for undergraduate? The answer is it's intended for both. We intentionally designed the book to be accessible to students who really know nothing about health or about public health. We take great pains in the book to really make it accessible to what student can come from a poetry background, and I think the book should be understandable. And our intention was it can be used for introductory, undergraduate, or graduate.
And Can I make one more comment?
Oh, go ahead, Jim.
Yeah, so Sandro had asked me to take the question on misinformation, and I was looking at one that has the last word is misinformation, and I didn't scroll down enough to see that 2 questions down. It also talks about misinformation, specifically in our COVID class, but also in the introduction. We do very much grapple with that concept right now, and really talking about particularly we've talked about it in the COVID class because it's front and center in the national strategy for COVID, to actually regain the trust and make sure that we are funneling good, solid, evidence-based information. So we address that upfront and very squarely in several of our classes.
And just to add to the previous comment, we also mapped the chapters and the content to the CEPH foundational knowledge and foundational content. If any of you are in schools or programs of public health that have CEPH accreditation, so you can see the kinds of knowledge and content areas that we cover.
Sandro, you were mentioning the graduate and undergraduate audiences. We've noticed adoptions at multiple levels of public health programs, probably because of the engagement, of the book itself. It's really engaging and storytelling. Can you discuss maybe how, you could address maybe the rigor of a more advanced class with this content as well?
Yeah, I'll give you my take. I think Jim and Lisa could readily add to that. The idea behind the layering of content, there's the material in the book, there are the slides, there's the question bank, there are the podcasts, is obviously no one course can do all of this because the number of hours would be prohibitive. But the way we've seen it is the book is comprehensive enough as to be a truly rigorous graduate level course. It's if a student were to go over every chapter and do all the pieces that are related to it, it would be a very rigorous introductory graduate level course. At the same time, it's structured in such a way that if for an undergraduate, early undergraduate students, if they're just grasping the concepts, that's probably plenty for them. So I do think the book accordions, let's think of it that way, from early undergraduate to graduate. No question the book is designed for introductory at either level. But to my mind, the students can go into more or less depth, and I think the book stands at either level. Lisa, you want to add to that?
Yeah, and I would say it really tries to give students a very solid foundation, and what you do with that is up to you. You can take students to a much higher level, have them go deeper with the application of the material, say for graduate students, whereas maybe at the undergraduate level, it's more the foundational knowledge approach.
Mhm. The way that plays out in our classes, because we do have students who are in like a 4+1 program, so we do have some students who are doing undergraduate studies, and we have other students who are in PhD programs. And the way in which that fits in part is, particularly during COVID, we have turned over a lot of our actual class time to team presentations. So for example, they will really do a deep dive into, heart disease, or last week it was air pollution on a really very sophisticated level. But then they actually use the structures that we build into the textbook. So they talk about, in terms of air pollution, which is one of our leading causes of death globally, particularly in low and middle income countries. And so they talk about that in depth, about the epidemiology. Then they present the eco-social framework, then they present the life course framework, then they present something about prevention and something about health equity. So they really kind of use the structure that's in the front end of our book, but because of the level of the students in the class, they can go into that in considerable detail. So it not only amplifies, and then we post those on the Blackboard site. So they've got, the full suite of, 8 or 10 diseases that are covered, 8 or 10 risk factors that are covered. And we also, I forgot to mention this, but Lisa's done a wonderful job of putting together active learner exercises. So every week, one of our teams presents the active learner exercise for the week. Last week, I just happened to remember, it was the air pollution active learner exercise. And we had the air pollution risk factor presentation. So they really dovetailed nicely.
Great. Well, I think all the questions were answered. To get access to this new content, it will be available on Springer Connect very soon. And you can also interact with your salesperson if you need it earlier than it's live. I believe it'll be live later this month, probably in about a week. But if you need it sooner to make a decision on the book, let us know, and we can send you access to the podcasts, and we can send you access to the new case studies related to COVID-19, and obviously any other ancillaries or e-access you need to look at the textbook more broadly. We are happy to do that as well. I think that's all we have the time for today.
David, could I ask one question?
Yes.
I'm not sure if I'm allowed to do this because I'm not sure if it's legal to do this within the session that you're running. But I had mentioned one comment, and I'm not sure, this is certainly not a decision that's been made internally, but is there ever an option to get persons who adopt the textbook to have some of their students maybe generate some case studies that we could review, and perhaps we could collectively from our classes and maybe from other classes, and I'm not sure, this is just an idea, to maybe put together, especially with COVID, which is that, that fire hose experience, to maybe be able to have good science-based authoritative case studies, but to have other students engaged in writing some of them.
Jim, that's a really interesting question, and maybe it's something where we can give a note with your email if they want to be in touch with you about case studies that they think are missing, in terms of the overall fabric of public health, or maybe we just couldn't get to them because there's so many. But if we can send maybe a note out to instructors with your contact information, that could be a way to do it. Okay, well, thank you so much for joining us today. Please visit us at www.springerpub.com/public-health for more information about the textbook. And you feel free to send any questions and comments through email. There will be a short survey at the end, which we hope you fill out as well. Take care and stay safe. And thanks again to our presenters today for providing this presentation.
Thank you, everybody.
Thank you.